Okay, hello everybody. And we are going live. Can you hear me, Lisa?
Yes, I can.
So I will, hi everyone, I'm Dr. Westman, and I wanted to bring Lisa in, and I'm going to drop off in the back and wait till you call me.
Okay.
All right.
Hi, everyone. Well, I'm Lisa. I'm going to be your host for this evening. So I think Dr. Westman was trying to make me feel comfortable. So that's why he popped on. But we'll get started shortly. Welcome to Dr. Westman's Keto Workshop. Thank you so much for being here with us today. Please let us know in the comments that you are here and where you're tuning in from. Okay, let's see. Judy from Australia. Hi. Iowa, Barbara, Angela from Virginia, Kathy from Michigan, Diana, Charlene from Lancaster, Pennsylvania. Hi, everyone. Oh, it's running. Okay. Bridgeville, Barbara from Bridgeville. It's jumping up and down, and I can't read quickly. Hi, everyone. Cindy, Daphne, Charlotte, Floy. So glad you guys could all be here tonight. Thank you. Patrick from Chicago, Paula from North Carolina, C, it's showing from Toronto, Darla from Arizona. Hi, guys. Hi. Okay, so let me just tell you exactly how it's going to go down tonight and the next 4 weeks. So every Monday, starting tonight, we are going to be live on the Adapt Your Life Facebook page and on the Adapt Your Life YouTube channel. And we're also going to be live streaming into 8 different groups. So we may not see, you guys may not see everybody's comments because you may be in one particular group, whereas we can get to see kind of everyone's comments. Wherever you're tuning in from this week, make sure to come back here to the same place next week. And each of these workshop sessions is going to build on the previous one. So by the end of the workshop, which is July 26th, you're going to understand exactly what the keto lifestyle is and all the amazing benefits you can derive from it. We will also have these sessions available to watch on the Adapt Your Life YouTube channel if you missed any of them. And in today's session, Dr. Westman is actually going to talk about the history of low-carb diets and why over the years keto has changed into what we now call internet keto versus science-based keto. And the truth is that there's a lot of misinformation and conflicting information out there. And honestly, people are frustrated. They're trying to figure out what's right and what's wrong when it comes to the keto lifestyle. And there is a lot of confusion. So really the purpose of this four-part keto workshop series is to clarify the misinformation so that you feel less overwhelmed and confused and more confident in your food choices. Now, if you're not able to join us on Mondays at 7:30 p.m. Eastern, it's going to be the same time each week, and you don't want to miss any of the live sessions, you are welcome to subscribe to our Adapt Your Life Academy mailing list, and we'd be happy to send each of these workshop sessions directly to your inbox each week. So our team will add a link down below, and if you'd like to subscribe, feel free to do so. That way it gets into your inbox. Alternatively, just either you can go to our Facebook page or whichever group we're streaming in or page we're streaming on right now, come back here and it should be available for you to watch on the replay. Then we also have a fun contest going on. So what we're going to do is we're going to be picking 2 winners each week to receive a signed copy of Dr. Westman's new book. I'm sure most of you have seen it or know about it. It's called End Your Carb Confusion. And in order to win, this is what we need you to do. So here are the 2 things, and you have 2 chances every week to win. So number 1, we want you to share tonight's broadcast. And number 2, we want you to leave a reply on this post with any big takeaways that you have during tonight's presentation. So 1 winner will come from the group of the people who have shared tonight's live session, and the second winner will come from the group of people who have left a comment on the post. So we're going to do that each week for the 4 weeks. So good luck to all of you. Then lastly, on the final session of the Keto Workshop, which again is July 26th, after Dr. Westman's presentation, we're going to open it up for Q&A. So if you have any questions at any time during the workshop, please join us on July 26th for the Q&A session. I'd also like to take a minute, lastly, to let you know, for those of you who may not know who Dr. Westman is, tell you a little bit about him. So for the past 2 decades, Dr. Westman has helped tens of thousands of patients in his Keto Medicine Clinic at Duke University lose weight and reverse chronic conditions like type 2 diabetes, hypertension, acid reflux, and more. And not only is he an associate professor of medicine at Duke University, who's board certified in obesity medicine and internal medicine, but he's very, very much involved in the clinical research of low carbohydrate ketogenic diets. So you can be sure that he knows what he's talking about. All right, let's get to our presentation today. I'm going to bring Dr. Westman on right now. Doc, are you there? Are you ready?
Here I am, yeah. Thank you, Lisa. Thanks for the introduction.
Great. I'm really excited about this Keto Workshop series. And today's session is the first of the 4-part series. This is the first time that we are doing this with PowerPoint each week. So, Doc, can you tell us why tonight's presentation is so important for everybody watching?
Well, it's important to know where things have come from. Yeah, I was a history major in college, actually, and then became a physician, a doctor, and got kind of disillusioned because the things I was taught didn't work. And then I found the lifestyle change and keto in particular. So that's why I gravitated toward it. I was able to help people. And so knowing where keto has come from, and I've been in this space of nutrition now for 20 years, I'm going to give some insights as to what we know that scientifically can work about keto diets, and then what we don't know can work or not about keto diets. So helping you to separate the wheat from the chaff, so to speak. The good, we know that will work, from the, well, we really don't know. You're kind of taking your chances on that stuff. But so tonight it's going to be, what does the science tell us? And yeah, I'm going to geek out. Sorry about that, but I have to be one of the doctors who shows the studies and the studies that I've been involved in, because there are a lot of posers out there. I mean, not to name any names, but there are a lot of people who claim there are things that can happen with their programs. I'm going to show you tonight and try to explain the science. And yeah, I like to do it in ways that you can understand, even if you're not a researcher or scientist. So not to worry, but I need to show some studies, and the progression will be, here's the science, and then over the next few weeks we're going to show you the how to do it, the application of it, how to get started, and the sugar insulin story has to be told. That'll be in there as well. So tonight we'll start with kind of a story of how this all started.
Great. All right. Well, with that, I'm going to take myself out and hand it over to you.
Thank you so much, Lisa.
You're welcome.
So it was 2 patients who came to me in 1998. I'm working at the Durham Veterans Affairs Hospital in Durham, North Carolina. I'm still there now, but take you back 20 years. These two people had fixed themselves basically without me doing anything. They basically did a low-carb keto diet. That's how I was introduced to it, by two of my patients doing it. I was curious. I went to meet doctors who were using this and then started to do research to either validate or not validate it. I knew it could work. I had seen several people do it, but I wasn't sure that it was safe. So that's really kind of the story to bring you up to speed on the safety of it. When we all were introduced to this 20 years ago, there wasn't a whole lot of research behind it. And today I'd like to introduce you to the research that's been done and tell you some stories from the research that I did as well. So I'm going to share my screen here and then bring up a PowerPoint slide set here for you. In fact, this is kind of like having you come to a session like Low-Carb USA or Public Health Collaboration or Salt Lake, Keto Salt Lake. I gave seminars like this at those places. But so tonight's, let's call it a mini lecture or session, is going to be the history of keto diets, the science and the fiction, science versus fiction. And that's me. I'm an associate professor at Duke University in Durham, North Carolina. Ever since I was trained in internal medicine in 1990, received my medical training, did a fellowship here at Duke. I've stayed here ever since. So what I got into when those two patients started this diet, as I was trying to figure out whether there was science to back up what they did, to make sure that it was healthy, there were no studies. And so we did a good literature search, meaning we looked in the literature. We found that there was a taboo on studying low-carb keto diets. And what that means is that no one really was studying it. No one could do it. There was sort of like a taboo means there isn't a law against it or a rule you can't study it. It's just nobody did. Nobody thought it was worth studying. And so we tracked back to 1980. The last study we could find on a low-carb diet was this one with 24 people. That was it. 24. It wasn't even a randomized trial. It wasn't a big study over a long period of time. It was 24 people, and they basically went 8 weeks on a low-carb diet, and they lost weight, but there was an increase in their LDL. And so therefore, they concluded that this diet will kill you, and you shouldn't ever do it. And that was the kind of the nail in the coffin for why no one was studying low-carb diets when we got into it. So Jeff Volek and Jeff happened to be at the University of Connecticut at the time. Now he's at Ohio State in Columbus, Ohio. We both did a research project and published our papers over the same month, I believe it was, in 2002. So we both started doing research on the low-carb diet, breaking this taboo. Actually, I didn't know there was a taboo. And Jeff was a researcher, still is, trained in nutrition and exercise physiology. And he knew, I think, what he was getting into, the kind of hornet's nest. I wasn't so aware of that. But what I was doing was following the data that my patients were doing this, and I wanted to figure out if it was healthy. So in 2002, we published this first paper, basically 50 people over 6 months on the low-carb keto diet, published it in a peer-reviewed journal, looked at the weight and the cholesterol levels and all that. We didn't find the LDL went up. It actually went down 10 points. So I'm learning, not everyone has that kind of response. And looking back to 1980, they only studied 24 people. We studied 50. We doubled the number of people in the research world in just one study. And so today, what I say kind of cheekily is, if you show me a paper, 6 months of a diet of a program and publish it in a peer-reviewed journal, then I'll comment on it. because that's what we did. The first thing we did is we took the information that we learned from doctors using this approach and published the paper and kept publishing it. But when I look through the lens of time, I mean, this is almost 20 years ago now, and the research has progressed. But the importance of these two studies is that it broke this taboo on studying low-carb diet. So today, unfortunately, we have this internet keto confusion, and people come to this. And in my office now in Durham, yes, you can see me in Durham, North Carolina at the Keto Medicine Clinic. I changed the name to the Keto Medicine Clinic. And the problem today I see in my patients is people are confused. They go onto the internet and they try to learn here and there and every which way and buy this product and that product and drink ketones and all. No, I'm going to try to dispel all of those notions, at least that we don't have evidence about just about all of the internet confusion. And let's start with what we do know about doing a proper low-carb diet. So just to keep showing, I want to show that this is evidence-based, meaning there are many, many studies now. That one study we did in 50 people was published in 2002. Our next study was published in 2004. My colleague, Will Yancey, I have an arrow there, Yancey, he's still my colleague at Duke, and we work together on programs and review papers now and work in the same clinic one day a week. This was a randomized trial comparing low carb and low fat diets. And our study was just one of many now that were being done. And all of these other people, Bonnie Bream, the Bream study, Gary Foster, the Danzinger, the Gardner, these other people wanted to do studies to show that it didn't work. And actually it did work and it was safe, but they wanted to show that it wasn't safe and it wouldn't work. So they didn't find what they wanted to. And so they never studied it again, which is kind of sad, but just looking at this slide and here, the reference on the far left is the first author on the paper with the year. So Yancey 2004 is our paper in this mixture of them. N means the number of people in the study. N means the sample size or the number. So we had 119 people over 6 months, and the low-fat diet worked. There was a 6.5 kilogram reduction on our study, which is the second row down, but the low-carb diet worked better. There was a 12.0 reduction in kilograms, and it was statistically significant between the groups. So what happened is a bunch of researchers, many of these people were doing the first low-carb study ever. There was a little secret. We went out and talked to doctors who had done this diet before. I visited Dr. Atkins in his office. I visited Dr. Rosedale and Dr. Bernstein, and Dr. Eads had retired by then, Mike and Mary Dan, so I couldn't visit them. But anyway, so we kind of got a leg up on what to do, and you can see that our results were best, even compared to the 12-month studies, because we actually talked to doctors who were doing the study and learned about the 20-gram carb rule, learned how to give a very simple education on one sheet of paper. And we've continued to do that in our research studies and in our clinical practice since that time. But so these studies, we didn't all get together and say, hey, let's all study low fat versus low carb. Low fat is what everyone was doing. It was what the major medical centers were teaching. There was a big study going on. Low fat was best. Well, not really. So low carb actually beats out the low fat diets. And now just over time, what happens is, what happened to me was, 6 months, that's great. What happens at 6 months in a day? And I said, well, I don't know. We stopped the study at 6 months. And everything looked fine. Well, you don't know. And so they would say, well, you need to do it for 12 months. And so here are the studies for 12 months looking at the very low carb diet versus low fat diet. Now the acronyms VLCKD means very low carbohydrate ketogenic diet, and then LFD means low fat diet. But so into the 12-month studies, again, the low carb beats out the low fat diets. It's not that low fat can't work. It certainly can, especially in a research program like this, but low carb diets work as well. And now the 12-month studies are out, and then I'm at meetings and they go, well, what happened to 12 months in a day? I'm like, well, wait a minute. it looks fine at 12 months and in a day. So anyway, you can never win. You never can do a long enough study when you're a researcher, because you always want to do more research, is another one of the jokes there. Right, so Dr. Yancey, Will Yancey, my colleague at Duke, thought, let's start using this in our VA population. Those are the patients I started with who showed me that they could do it. And let's use this diet versus a diet and a drug. So LCKD here means keto diet, low carb keto diet, versus orlistat, a low fat diet and a drug that blocks fat absorption. And in this medically ill population of Veterans Affairs outpatients, so we're starting to get some good information in people who are not healthy. They have other problems. They have diabetes, obesity, hypertension, that sort of thing. And this paper basically showed, published in the Archives of Internal Medicine 2010, that a diet by itself, the low-carb keto diet, is as good as a diet and a drug, the orlistat and a low-fat diet. So as I was presenting this data, the other researchers were kind of saying, wow, that's a pretty potent diet. It's as good as a diet and a drug. So yes, this is a powerful way of helping people change lifestyle, losing weight, diabetes, all these things get better. So we're starting to learn now that, wow, if someone's on medications, we need to be careful. We need to monitor carefully as people don't need the medicines anymore. That's called de-prescribing. And that's going to be a theme through this workshop, that if you're on medications, you have to be monitored carefully, because even on the first day, this can be so powerful that the diabetes medicines may need to be stopped or greatly reduced. Yeah, diabetes medicine. So I love this paper, this graph, because in red is the low carb diet, the keto diet, and that shows every individual's results. And in blue is the low fat diet with orlistat. So this is an important part of the research understanding, is that the average just shows you the average, that some people gained less or lost less, some people lost more. And you can see there's great variability in both approaches. Some people, a few people actually gained weight on the low carb diet. Well, it's because they weren't doing it. They weren't following it. But so this a big lesson here is you want to look at studies and look more than just at the average result. And you want to see the variation. And this is what I see in my office practice, is that some people just glom onto this. It's easy, and they're down 30 kilos by the end of 6 months, which is 30% body weight. It's amazing. And so that variability is an important thing to see on this graph. That's the shaded lines there are every individual result. The average or the mean is the bold line, showing that the low-carb keto diet did as good as a diet and a drug. Now, there's so many studies. I thank the public health collaboration of the UK. Sam Feltham is the director there, or president there in the UK, and they put together this infographic of all the studies, and even have them listed with the references if you wanted to follow them up. But they put it kind of into this scorecard. This infographic shows that in blue that there was significantly greater weight loss for low carb 31 times and 0 times for low fat. So if this was a football or soccer game, the score is 31-0. The low carb diet beats out the low fat diet. Now, it's not that the low fat diet can't work, but have you noticed that it's kind of fading away from the popular discussion and the low carb kind of discussion, and going against sugar and all this is now in the dominant cultural approach. And that's because the low-fat diet actually never really was based in science. So that's a whole nother lecture. The books to read about that are Good Calories, Bad Calories, or The Big Fat Surprise by Gary Taubes and Nina Teicholz. I'm going to show you the clinical trials since the year 2000 here. So I went to become the president of the largest organization of weight loss doctors in the world, the medical weight loss, not the surgical ones. That's called the Obesity Medicine Association. And we created a guideline to bring together our knowledge base, kind of our algorithm guideline is what we know to be scientifically solid in terms of obesity treatment. So the Obesity Medicine Association has this slide, and the low carb diet in the guideline as one of the approaches that is safe and effective to use. So the low-carb diet's in the guideline of the American or the Obesity Medicine Association. So are low-fat diets, and so are very low-calorie diets, and so are medications, and so are surgeries. But I don't really use that first line in my practice. I focus using this type of approach because of all of it's less risk, less money, and still has great success. Turning to diabetes. Actually, diabetes was being treated with a low-carb diet before I was born. Before many of it. So a patient of mine at the VA, when I was there doing my first study, brought me this book. She was a used bookseller in a nearby town, and she brought this book to me and thought, I heard you were a history buff, maybe you'd like this old book. So I'm thumbing through this book while I'm doing my first study, and the hospital director got a complaint, and they wanted to shut down my first study at the VA, and it didn't happen, but that there was this posturing to do that. And this book, I look, 1923, Sir William Osler is the father of internal medicine, basically created the field to be able to treat hypertension and diabetes, these chronic medical conditions. And in 1923, the diet they used to treat diabetes is there in the box in the green in the middle. It's basically 10 grams of carbohydrate per day. It's a low-carb ketogenic diet. And so I was reassured, this is now 1999, in the middle of my first study on the low-carb, high-fat diet. I was reassured that they were using this, 70 years before I was doing my study, while the hospital director was being complained to by a dietitian. And anyway, when there were no medications to treat diabetes, all there was lifestyle. The low-carb keto diet was the treatment for diabetes. And it still works today. So this is what I start people out on with diabetes. Now, the research studies are not quite as solid. They're not as many as for the treatment of obesity, but there are a growing number of studies for diabetes. And under supervision and with a doctor, it's completely safe and effective to do. But the research isn't quite as solid. And this is a graph, an interesting graph that basically shows the amount of data in a comparative way, so that the solid ball, if you will, the blue ball shows you the number of people in the studies, and then the thickness of the line is the number of studies done. So if there's a big ball with a lot of large spoke coming away from it, there's a lot of studies done. If there's a small ball with a small number, a small line, that means fewer studies. So you can see here the low-carb diet in the middle of the screen has as many studies as moderate carb, high protein, Mediterranean. There are more studies about low-carb diets than vegetarian diets because the ball is bigger. And of course, low-fat diet was studied for 50 years, and it has the biggest ball, but that doesn't mean it works. As you see so far, in the comparative trials, low-carb works better than low-fat. So just imagine when we get more and more studies on low-carb diets, the effects that can be seen here. This is just to show that there are as many studies on low-carb diets as any other kind of diet for diabetes. And then recently, in just the last couple of years, the pivotal study or pioneering study done by Virta Health out of Silicon Valley. This is a company that is using a keto diet through the internet teaching or classes. This was a study that used a combination of the two, and the goal was to keep people in ketosis by blood ketone measurement. And they stepped on a scale every day. They had a doctor in the app of the phone who was licensed in the States so that they could help you get off the medicines. And what they show was, it's basically miraculous that there's a reduction in hemoglobin A1C from 7 to 6 with reduction in medications. And there was a 14% weight loss at a year and 10% at 2 years. So diabetes was reversed in 52% of the people and put into remission by 18%. And it's a matter of time and staying to the program. Of course, that's a major theme here, is you got to stick to it. And I'm not going to have any qualms about that. I'm going to say it, over and over and over. You have to be strict. You have to be strict every day, 24/7. If you have diabetes, for it to work. you may not have to be so strict if you don't have a metabolic problem like that. But this study was done by Sarah Hallberg as the first author on one of the second papers here. And you might know Dr. Hallberg, Dr. Sarah, because she did one of the TED Talks on diabetes, and it shows she gets up and says, I have the best job ever, and I'm a doctor. And she talks about how she reverses diabetes in her practice. It's a great TED Talk, if you haven't seen it, by Dr. Sarah Hallberg. They also, in this study, lined up all of the risk factors and metabolic factors in the blood in one table. And so what this shows is a snapshot. If we measured everything in your body when you were a year or two into a keto diet, everything gets better. You have to just trust me, the direction of these things is getting better, except one thing, and that's the total LDL. And so, yes, some people have an increase, most people have a reduction, and some people have an elevation more than you might want, according to the classic teaching, but this is okay. So everything else is getting better, and I will be able to explain why this changes to you, or might happen to you, but probably won't happen. But if it does, why it happens in this workshop over the next few weeks. So the main theme is that the low-carb diets just work in a different way. They work by lowering the triglyceride. Here in this graph, it's called TG in the figure with the column. So TG, triglycerides go down, and HDL, the good cholesterol, goes up, and the small LDL, the atherogenic LDLs, go down. So what the high-fat, low-carb diet does is lowers the metabolic risk and heart disease risk by addressing the metabolic syndrome, the triglyceride and the HDL, not always the LDL. And that's okay. But I know there's a lot of confusion about that, and I'll teach that over and over and over so you can understand it. Now, some people wait for a guideline for following something, or doctors often do that. And so for diabetes, yes, the low-carb diet is in a guideline from the American Diabetes Association. So 2 years ago, the ADA, American Diabetes Association, published a paper, a consensus group that basically said low-carb diets work great, probably better than other diets because it lowers the carbs, and carbs raise the insulin and the blood sugar. And so like any program, you want to do it with monitoring. So, check, there's now a major medical organization for diabetes that endorses the use of a low-carb keto diet for diabetes. Just want to emphasize again, the keto diet addresses insulin resistance and the metabolic syndrome. And next week, we're going to talk about the glucose elevation when you eat carbs, and the insulin going up, and insulin resistance, and all that mess that happens if you're sensitive to carbohydrates. We also call it carbohydrate intolerance. And so the old way to look at a lipid panel in your doctor's office is to look at the total and the LDL cholesterol. That's the old normal here in the column in the middle. But what we are going to be talking about is on the right-hand side here, the new keto normal, which means you have a reduction in triglyceride, you have an elevation in HDL, you have a reduction in your abdominal obesity or your waist circumference, or you lose weight. And you lower the blood pressure, lower the blood glucose. All of these things get better. This is not new information. Dr. Gerald Reaven at Stanford University in the US, in California, talked about this in the 1970s. There are the references at the bottom, and it just wasn't really appreciated. And one of the reasons is there were no drugs that immediately became available to use in a doctor's office to treat it. So here we have Jeff Volek, as I mentioned, J.S. Volek at the bottom, a summary paper there, and lipids going into great detail about this difference. The main thing is just to realize that it just goes about it in a different way. It's like driving on the left-hand side of the road in the country you're living in, or driving on the right-hand side of the road. And I learned that when I'm in countries where they drive on the left-hand side of the road, I'm going to have someone else drive for me, because, it's just seems weird. And that might seem weird to you as a kind of big picture view when you're changing what you eat, and you're eating more fat, and you're eating less carbs, and you're all these things. And the doctor talks about the total cholesterol, and you want to talk about the HDL and cholesterol. I mean, it anyway, it's just another way to do it, and we can help you as you go along when these issues come up, if they do for you. So another theme for this workshop is not all low carb diets are keto, and not all keto diets are evidence-based. So in the studies that I showed you so far, there have been no studies involving drinking ketones for weight loss. There have been no studies drinking medium chain triglyceride for weight loss or diabetes reduction. There are no studies of using apps, requiring the Virta Health study had apps and keto finger pricking and all that, but you don't have to do all that. But you don't have to purchase apple cider vinegar and all these different electrolyte formulas. The main theme in the workshop, and from my teaching and from what I've learned from evidence-based keto, is you want to keep the carbs low. And here on the left-hand side, the y-axis, I'm going to keep the total carbohydrate grams low. We'll get into the difference between total and net, but I start out in my office under 20 grams because I treat a lot of people with diabetes. You might be able to have 50. You might even be able to have more than that, depending on your specific metabolism, and we'll help you figure that out as well. So I've been using this in my office at Duke now for 14 years. It treated thousands of people and all of these different medical issues. I will treat basically any medical problem as long as there's medical monitoring, and that we monitor whatever that medical problem is. I am a big fan of checking the blood glucoses at home, checking the blood pressures at home. If you're coming off medicine, you're on medicine for those things, home monitoring is really, really helpful. And that's to prevent any sort of safety issues or even side effects from that. Today, more and more, I see people thinking things like, oh, fatty liver, that means don't eat fat. No, it means don't eat carbs. And I mean, this is doctors making that mistake. And then, the acid reflux or GERD, well, just don't have spicy foods. No, it's carbs that cause heartburn. So anyway, we'll talk about not only the medical issues, but also the non-medical issues that improve as well. A little results, sure, this works. I mean, it's like asking a doctor who uses a blood pressure medicine, does that blood pressure medicine work? Well, yeah, I use it every day and the blood pressure goes down. But just to show, yes, I use this every day and the weight goes down. We have seen many more people now than this because the survey ended in 2017 for this, but it gives you a snapshot of that period of time. And I'm in an insurance pay system where 50% are private, 50% are public, and that's important because there are different limitations and barriers in every kind of practice. But we've helped these 2,000 people lose over 26,000 pounds, and that just shows that not everyone does it. Not everyone is able to do it without the support and monitoring. We've learned to give that support now through our classes and our support groups to improve your success. Now, reducing blood glucose and insulin, I'll get into this next time, does a lot of other things too. And you may be surprised to learn that cancer, even many cancers, grow on sugar or glucose. And there's a lot of suspicion that brain issues like Alzheimer's, Parkinson's also can get better by reducing the glucose. It's a glucose toxicity sort of thing. And even living longer, and I'll get into that next time. You want to keep insulin low. That's a general theme for healthy living. It doesn't matter what you eat, keep insulin low. So the internet keto confusion today comes from this macro focus and ketone levels. You don't need to do any of that. The food quality issues, grass-fed beef and all that, you don't really need to do that. It's nice if you can, but what we'll focus on is in the middle here, low carb, high fat, low carb keto or evidence-based keto. It focuses on carb restriction and using total carbs, not net carbs. And if you don't know what that means, we'll get into that over this workshop series. So just to sum up, evidence-based keto is safe and effective for obesity and diabetes and many other things when it's done right. Beware of the use of products or methods that might impair the success or safety of the things on the internet keto, we call it. And if medical conditions are present, please know that monitoring to safely deprescribe medicines is needed. And the next workshop, we're going to talk about how sugar and insulin affects our bodies and why you want to keep the sugar and insulin low in your body for your optimal health. Well, there you go. There you have it.
That was great. Thank you, Dr. Westman.
I hope I didn't put you to sleep. But
no,
not
at all. I'm actually glad that you brought me back in, because I just want to, there's a lot of people that are joining us and watching on YouTube. And as usual, there's always a few trolls in YouTube. So what I want to tell everybody is, if there is a troll, some people have said there's a troll, just ignore the trolls, and we'll deal with them later. We'll block them later. So don't worry about that. What else did I want to say? Next week, what I'm going to do is I'm going to share who the two winners were from tonight's session at the start of next week's session. So be sure to join us again next week. And I will mention who you guys were. Remember, the two things you needed to do were you needed to share. And the second thing is that you needed to comment on what your biggest takeaway was from tonight's session. And then at the start of next week's session, we will mention who those two winners were and how you can get in contact with us for your addresses, and we'll send you a signed copy of End Your Carb Confusion. Okay, so any closing thoughts, Doc?
No, I can't wait to get to next week. So I'll see you next week, Monday night, 7:30 p.m. Eastern.
Same time, and you can always find this available to watch on the Adapt Your Life YouTube channel or the Adapt Your Life page. But we'll see you next week.
All right. Bye-bye.
Okay. Bye. Thanks.